Hello and welcome to Existential Joy. I am here with my friend and co-founder of this wonderful website, Mandarr, and we are here to talk about a fascinating experience that they had. They actually underwent a hysterectomy a little while ago, and they are here to talk about that experience. Say hi, Mandarr.
Hello.
So, first things first, what was the process like for you of actually getting this hysterectomy? Like both in terms of, insurance and how that all played out, as well as, let's talk about what the procedure was like.
So the logistical process early on was kind of a bit of a mess, to be honest. I was extraordinarily lucky in that through my work, I was able to access a center at one of the local hospitals that particularly worked with trans and gender variant individuals. And the coordinator for that center is someone who didn't really provide direct care at all to patients, but who did all of the coordination of various kinds of other cares. That coordinator was also really knowledgeable about what what conditions needed to be met for different insurance plans for different surgeries. So the fact that I was particularly looking for a hysterectomy meant that I actually needed to do more paperwork and have more than one mental health practitioner essentially sign off on my ability to make that decision than would have been required for something like top surgery.
And why is that?
I'm a bit of a cynic and also someone who tends to see the world with a fairly political bent. I'm inclined to say it's because people who have ovaries are basically designated as baby-making factories. There is a greater concern, I think, with any sort of genital change, whether it's not that a hysterectomy is a genital change, but really anything urogenital or pelvic. The medical industrial complex regards your decision to parent as probably more life-impacting long-term than your decision on whether or not to, for example, breastfeed, or the size or shape of your chest, even though that can have a more dramatic impact, I think, on a lot of people's lives sociologically, just based on how their chest shape makes them perceived in the world as they walk through it. So I was incredibly lucky to have access to a person who was able to coordinate a lot of care for me. That said, there were still several hiccups. It was really easy to get the paperwork done that I needed to have done from one mental health provider who is very trans competent and helpful and knowledgeable and absolutely willing to say that, yeah, you are absolutely more than capable of making these decisions for yourself. Just getting a second provider to sign off, like literally just getting in the office of a second provider, was a bit of a mess because, to be honest, we don't have enough healthcare practitioners, particularly in mental health care practitioners, anywhere. I had actually had a different therapist that I'd been working with fairly consistently for several years, but he was working with me primarily because of the neurological disabilities that I have. He'd never had a trans patient before other than me, and it had never really come up because it wasn't much of a problem. And as a result, he really did not feel like he was willing or prepared to sign off on that paperwork, and I still feel a little bit conflicted and weird about that. I can sort of respect his decision to really only want to make clinical judgments on his speciality. I was more than a little bit frustrated that someone who had seen me healthfully and stably hold a trans identity for several years was unwilling to essentially say that, yes, this person identifies as trans, and yes, I support their ability to make long-term healthcare decisions for themselves. I mean, realistically, if you're going to work in an urban setting, the chances that you will never encounter a trans or gender variant patient across a 30-year career are obscenely low. You will probably encounter several, no matter where you work. Trans people also get depressed. Trans people also get anxious and have ADHD and OCD, and they come in the same mental health variety of colors that cis people do. If you think it's remotely important to have any sort of social worker or therapist or psychologist get any training on racial biases or socioeconomic injustice, which I would argue is indispensable in that profession, then it would make just as much sense to also educate them about gender variance. In part because if you're going to insist that regardless of what services they're seeking, trans patients should only be seen by trans psychologists and people who have spent their whole careers specializing in gender identity issues pertaining to trans people, then ultimately what you're going to do is really limit and restrict access of trans people to therapeutic and mental health services. But we also, I think, really need to get away from the idea that a person, that a general doctor really needs any particularly specialized training to interact with a trans person who has pneumonia, other than the fact that you should be treating them as a decent person and maybe have a little bit of practice with different pronouns that they ask you to use.
Can you tell me about first any prep before surgery? What the actual procedure was? Because you had a total hysterectomy, correct? Like ovaries and uterus?
No, actually. So a total hysterectomy, correct, would refer to the uterus and the cervix and the ovaries and fallopian tubes being removed. I had a hysterectomy in which I removed the cervix and the uterus, and a salpingectomy, which removed the fallopian tubes, but we left the ovaries in sort of as a backup hormonal system so that I can kind of choose if and when I want to go on T and how much, and fluctuations in that don't really have to bother me too much because I still have functional ovaries that will continue to produce estrogen. Prep was relatively simple. I did very well on a relatively high protein and high fiber diet before and afterwards, and I would recommend that for most cases where folks are trying to heal from pretty significant injuries, if they can and if that works for them. My surgeon was actually a person who really had spent a lot of time earlier in her career, and she's still quite young, researching some of the best ways to enable resiliency in patients and get them up and walking sooner, and also using fewer opioids. The system that she used to try and do that basically meant putting no actual food restrictions on patients at all, essentially saying you can eat whatever you want up until midnight the day before surgery, and as soon as you wake up you can eat whatever you want. She said, spoiler alert, it probably won't be much, and lo and behold, it wasn't. She did have me drink basically a full bottle of Gatorade the night beforehand, and another one that morning. That was the only thing that I had to eat or drink that entire day, and my surgery was in the afternoon. It was gross, but apparently the return on investment for all those electrolytes is very worth it. And that was, I think, somewhat unusual. I think most surgeons will have you drink nothing, not even water, never mind Gatorade. Other than that, it was quite a lot of blood draws. They insisted on doing a pregnancy test with a urine sample, which I personally hate, but we got through it. They actually had me remove all of my piercings, including, all the ones in my ears, for example, which I was a little surprised by mostly, just because they seemed very much out of the way. I believe that was because just in case they needed to use the EKG, they didn't want those interfering with them, or in case they needed to use an MRI, they didn't want any interference from the metals. That was about it. They didn't need to mark anything beforehand. We were doing a laparoscopic hysterectomy, which meant that there were 4 little incisions made in my abdomen, 3 kind of at the sides, 2 on one side and a third on the other of my lower belly, and a 4th in my belly button itself. And those are very small. They're about a centimeter wide, not even that. And those incisions actually just allow for the laparoscope, or essentially little robotic cameras, to be inserted, and that gives them a good surround visual to cut the uterus and cervix, essentially out of the vaginal wall, vaginally. They didn't macerate, fortunately.
And can you explain maceration to the masses?
They didn't have to cut the uterus into several little pieces in order to withdraw it. They were able to essentially cut out around the circumference of the cervix, and then using the sites from the laparoscope, they were able to essentially snip the ovaries off at the fallopian tubes and then withdraw the whole system out in one piece. Don't know that folks necessarily know this, but I actually instruct medical students how to give pelvic exams myself. I am told, apparently, that when they had first administered the anesthesia on the operating table, I had, like, quite the conversation with one of the PAs about a study that had recently been published about, like, automatic power morcellators that can be used to macerate uteruses, and trying to mitigate clinical risks when they are absolutely necessary. I remember nothing of this conversation. I woke up feeling gross and dizzy and in such a fog, but one of the nursing staff, as she was bringing in some ginger ale for me, that it was great that I was a GTA and that she hadn't met one since she'd been in her own program. A GTA stands for Gynecological Teaching Associate. And I was like, how on earth did you know that? She was like, well, you gave us a mini lecture and then you talked to the PA about this article that had recently been published in Science. It's like, great, wish I'd been there for it.
You woke up feeling gross and awful, yeah?
Pretty shit. I mean, anesthesia is not a fun experience most of the time, or at least waking up from it. I think possibly the weirdest feeling is, so when they do a hysterectomy, it's a lot like a colonoscopy, which I had never had beforehand, in that they will fill up your abdomen with surgical gas, just so that when they insert the laparoscopes, they can get a better visual. And they do release the majority of it before you wake up out of surgery, but there's no way to get all of it out. At least not instantaneously through one valve. It will eventually all escape, but the last little bits of it will go via whatever channels it finds. Which, to be clear, is usually farting and burping, but like, before that, it floats around and gets really confused about what's going on. Because it starts, like, outside of your organs, but in your abdominal cavity, and it's the first inclination of it for a couple of days was to sort of float up towards my shoulder, and it was it was like having pins and needles, but only beneath my musculature. It was not entirely fun. So kind of like the tactile sensation of Pop Rocks. Maybe that's a little dramatic, but like a slightly more subdued version of that going on low-key almost all the time in some weird corner of your body you're not quite expecting. I was actually mobile-ish fairly early on. It was very difficult for me to use my torso or abdomen to do much. Like, standing and sitting were not easy for me to do, but once I was already standing, I could shuffle around a little bit. It's hard to describe why walking was difficult, because it's not like I was too exhausted or that my feet hurt, but I could certainly say that walking was possible, and speaking was possible, and breathing was possible, but all of them were kind of uncomfortable, and certainly really only one of those things could be done at the same time. Like, I would literally take a step, and then take another step, and then pause for a second, breathe in and out, and then take a step, and then another step. I have a lot of things going for my physical health, and also the fact that I did this in my 20s, when most people who have to get hysterectomies or don't get hysterectomies by choice, like, they are much more commonly getting them in their 50s. I think that helped quite a bit with my resiliency, but also I drank a fuck ton of fluid, which was really helpful for me gastroeconomically and helpful in terms of my energy levels. Did not help when we realized that my bladder did not remember how to be a bladder. So it is a very well-documented but bizarre and poorly understood phenomenon, specifically to do with bladders, in that it is very common for the bladder to just become unresponsive and to not really wake up and start acting like its normal self again on the same timeline as almost all of the other organs in the body. This was almost definitely exacerbated by the fact that the surgery that I had was pelvic, and therefore there was more localized anesthesia in the area. We've understood and documented for a while that of all the organs that you have, the bladder is often the last or most reluctant to wake up after the application of general anesthesia, and we have no idea why. It's just the case. And at no point was I ever really in any serious danger. My surgeon was not overwhelmingly concerned about it. There was definitely a point somewhere around 2.5 day-ish mark that I was like, I might never pee normally again. That was mostly my anxious brain being anxious. I did pee normally again eventually, thankfully, but not without the use of a catheter for, gosh, it was almost 3 days. And yep, no, it was terrible. I had a little bag that I had to basically strap to my leg just to collect urine. But I had to have a little urine bag strapped to my leg, and a Foley catheter inserted just all the times that it was on a slow drip.
If you're comfortable talking about this, were you on pelvic restrictions regarding sex or anything like that? Or I guess you probably don't need to use tampons now that you don't have a uterus, but...
I don't. It's amazing. Yes, so for 6 weeks after surgery, I was not meant to be having penetrative sex, and that is inclusive of really anything that involves vaginal insertion, just so that I wasn't jostling the new cuff while it was trying to heal. My surgeon was great in that. She was quite clear and inclusive with her instructions. And she said that any sort of external play with vibrators or masturbation or hand sex was totally fine, but that nothing, including toys or fingers or penises, should actually go into the vaginal canal, just in case it went a little too far, especially because my vaginal canal is a little bit shorter now than it was prior to surgery. To my surprise, she actually was perfectly okay, like, from the get-go, with anal play of any kind. She said, you may very well not feel up for it, but that would not endanger you or the healing cuff from my perspective, so have at it if you feel like it. I was not up for it for quite a bit, to be honest.
Yeah, so, and how are you feeling now?
Amazing, by and large. I do sometimes experience a little bit of, I guess I can only describe it as gender euphoria in just not having to worry about reproductive nonsense and not having to have periods, and just knowing that there's a lot of medical concerns there that I had been carrying for so long that I just don't really have to carry anymore. It does feel a little strange sometimes. I try to remember that I'm still actually kind of learning about and getting acquainted with my vaginal canal, or at least the very end of it. We've only been together for about 6 months. But I am sometimes a little bit surprised at the texture of the cuff under my fingers. It's a little more dramatically ridged than my cervix was, but the tissue itself is a bit softer. And it's a new feeling. Like, that body part definitely feels different than it used to.
Alright, so let's talk about what made you decide to do this in the first place. What was your thought process, your decision-making process for this?
So, for me, it was actually primarily about birth control. Like, I knew full well that even though I wasn't sure whether or not I wanted to parent, I was absolutely certain that I did not want to gestate a fetus. And while I had been fortunate enough to have access to some longer-term forms of birth control, like IUDs, and they'd worked relatively well for me, I did have one really unpleasant experience with my last one getting placed. It actually punctured the uterine wall, which is no fun. even though IUDs are a very low impact form of hormonal birth control and that the hormones tend to be very localized, so people tend to experience side effects from them less, I still had consistently had ongoing concerns about the fact that IUDs or any form of hormonal birth control, especially pills actually, are well known to positively correlate with the agitation of symptoms from a disability that I already had, and didn't really see it as particularly worth it to keep putting my body under that extra strain when the biggest benefit of an IUD is its reversibility, and I didn't really want that reversibility, which, led me to consider other forms of permanent birth control, like removing my fallopian tubes, or at the very least severing them. That would also be, somewhat permanent. I also briefly considered Escher, which is a little implant that can be inserted into fallopian tubes as a very minor surgical procedure that essentially blocks them and agitates them and causes scar tissue to form that doesn't allow eggs to pass through the fallopian tubes. There have been documented problems with those medically. And to be honest, as soon as I thought of getting tubal ligation or some other form of permanent birth control, my first thought was that, well, I'd probably still want to go back on some form of hormonal birth control because that's the only thing that means that I don't have periods. So it was this interesting combination of having a primary aim of really wanting permanent, reliable, stable birth control that I wasn't going to have to go back for every couple of years, and go through like this whole process in order to get it again, or heaven forbid have to pay for it again, depending on the political climate or the whims of whatever government I happen to be living with at the time. Also mitigated by this somewhat gender but also somewhat convenience-informed desire to just not menstruate again, and the knowledge that I really didn't want to be on pseudoestrogen if I could at all help it, just because it doing so wasn't aligning perfectly with my overall health goals, even if it did align pretty well with my reproductive health goals. And realistically, the only way to definitely not gestate and also not menstruate, but to not use fake estrogen to do that, is to not have a uterus in the first place. And that's really the only way to do all of those things. I actually at first didn't really see it as particularly gender affirming so much as like lifestyle choice affirming. Like, it really was for me primarily about birth control and secondarily about not menstruating. And I was actually very upfront about that with my provider, and they were very clear about my aims and objectives, and I think everyone wound up thinking that the easiest and most concise way to medically code the procedure, just to bill it to the insurance company in a way that made sense and was clear and didn't involve, two separate sets of justification processes, was simply to bill it as a gender-affirming hysterectomy. That worked out. I do sometimes feel like I have sort of almost with almost a ludicrous amount of fortune, stumbled onto maybe like the one loophole that is maybe easier for trans folks to jump through than cis women, at least in terms of accessing reproductive health care. It sometimes keeps me up a little bit at night to think about the fact that there was a lot of hassle and paperwork and loopholes and nonsense and a lot of little things that went wrong that at the time felt like they threatened to derail the whole thing for months leading up to it. But even then, compared to, I think, the average trans person I think I've had, or the average person trying to get a hysterectomy, I think I've had a relatively seamless process. And it does sometimes keep me up a little bit at night to think that, if a cisgendered woman was presenting with all of my same symptoms and was saying, I want permanent birth control, and also I hate menstruating, therefore I should not have a uterus, that person might have a much harder time accessing the same care I did. It also kind of keeps me up at night to think that there were points where just administratively or logistically or lots of people who didn't have nearly the same educational privileges that I have, or who was not as medically literate or able to kind of work medical and healthcare systems the way that I was, they might have had an even more delayed and lengthy process getting the care that they needed, or might have experienced outcomes that were just not quite as good. And it's a hard thought.
All right. So is there, I think that's pretty much like everything that I kind of wanted to cover. Is there anything that you want to like toss in about your experience?
Even now I still get little moments of, wow, this part of my body feels weird, or I wonder if I actually did make the right choice. Sometimes more as anxious or intrusive thoughts than actually really constructive or seriously thought out ones. But I think especially in trans culture, it's really easy to push to the fore narratives of superhuman healing and completely unmitigated self-validation that can come from gender-affirming surgery. And to be honest, like, both of those ideas are kind of ludicrous. Like, even when you have what is arguably one of the most ideal situations, it was still hard. It was still painful. Like, absolutely worth it, certainly. But I was still hobbling around like a tiny little 9-year-old with a walker for the first couple of days afterwards. It was not pleasant, and I have the same anxious brain that I've always had, and even though I can absolutely say that I have absolutely no regrets, I am still sometimes subjected to a little bit of self-doubt afterwards. So if the healing process of a trans person does not always look linear, especially emotionally, I would say that is not only perfectly normal, but probably almost uniformly the case, even though that's not necessarily what you'll be seeing on trans blogs all the time.
I think that might be the end of the interview. To the lovely invisible audience that has been with us this whole ride, thank you so much for listening. And thank you, Mandarr.
Thank you.